Hi, I'm Ali.
And I'm Megan.
We lead the development of the Elsa Health Assistant at Inspired Ideas. We're building the future of healthcare by leveraging advances in technology and data science to equip lower cadre healthcare workers and augment their capacity.
Hadija is a community health worker in Singida. She cares about people living in her community, but doesn't always feel confident that she's able to provide them with the best possible care. Unfortunately, she's correct. A study done by the World Bank in 2016 found that nurses in Tanzania, who often have more training than community health workers, currently diagnose a patient correctly around 37% of the time. In addition, community health workers traditionally access updated health information through trainings, which are difficult to hold on a regular basis, and printed guidelines, which have been shown to inconsistently reach the end user. During the time of COVID-19, information changes daily, meaning that community health workers need a way to get updated information quickly and build it directly into their decision-making process.
For these reasons, among others, we created the Elsa Health Assistant. Elsa is a digital tool that provides automatic symptom assessment, next steps recommendations, and digital follow-up for patients at risk of COVID-19 and other respiratory diseases.
A community health worker equipped with Elsa accesses the tool through a mobile application and provides their patients with a data and expert-backed assessment of their symptoms. They input some information about the patient to start, including their age, gender, and presenting symptoms. For each presenting symptom, they're asked to describe various attributes. After that, the Elsa Health Assistant walks them through a set of intelligently generated questions designed to dig deeper on signs and symptoms that are likely to lead to a diagnosis or to rule out the presence of other, possibly similar diseases. After the questions, the community health worker receives insights and next step recommendations about their patient's respiratory health based on guidelines and our intelligent algorithms. From there, the community health worker makes a decision about their patient. In some cases, patients might be referred to a local health facility for testing. The respective healthcare facility is alerted ahead of time to prevent potential COVID-19 patients waiting in line and spreading the virus. In other cases, a patient might be enrolled in a virtual follow-up program that tracks their symptoms over the course of 14 days and alerts them and their community health worker if they start getting worse. This is particularly valuable for the COVID-19 response in order to reduce the number of patients who are sick and in health facilities, but also ensure that they're monitored and supported over time. All of the data that is collected by Elsa is aggregated and accessible in a dashboard to supplement the monitoring and surveillance procedures currently being implemented by health stakeholders, including the Ministry of Health. Our solution supports community health workers during the time of COVID-19, but is easily extendable to other areas of healthcare delivery. In addition to strengthening primary care services, the use of digital technology to support community health workers with decision-making ensures more accurate identification of diseases and more empowered frontline care providers. During a recent pilot in Tanzania, 83% of users of the Elsa Health Assistant said it made them more productive, and over 80% indicated that they feel more credible and more reliable when using the tool. We have a team of passionate people who are dedicated to building the future of healthcare. You already know Ali and I. Our team also includes Kevin James, our software developer, Mariam Mohammed Ali, a medical doctor and the brains of Elsa, Jonathan Lukumai, who leads our implementation in southern Tanzania, and Happiness Watimanwa, our chief finance officer. We also have a number of mentors and health experts who engage with us regularly to test and validate our tools and algorithms. In order for Elsa to be successful, we are seeking connections with public health authorities and other stakeholders who we could work with to ensure successful implementation of the project with community health workers across Tanzania. We are also seeking funds to support the scale-up of the Elsa Health Assistant. We build digital tools to improve health outcomes and increase equity in healthcare. Fundamentally, we believe that digital tools can give patients and healthcare providers superpowers, allowing them to make better decisions. Thank you.